Hello, everybody. My name is James Marson. I'm a pediatric critical care physician from UC Davis Children's Hospital in Sacramento, California, and it's my pleasure to be here with the panel to discuss with you the topic of telehealth. Over the next 5 years, in what ways do you think that telehealth and telemedicine will impact the U.S. healthcare system?
So I think it's inevitable that over the next 5 years, we're going to have to see that. Now, the biggest barrier to doing this has been the lack of reimbursement for many of these services, and the fact that the laws and regulations across the country are very much outdated, starting with Medicare that only allows for reimbursement for live video, completely ignores the benefits of what's called store and forward and remote patient monitoring, as you mentioned, as one of the real valuable assets of telehealth. And then each state has their own laws and regulations, many of which are very complicated, convoluted, and I think don't even understand the true benefits of what telehealth is, or virtual care, as we like to call it now.
Definitely agree with that, and also add, I think just in general, consumers, patients, and providers are at a pretty good point where people are using this in their everyday lives. They have been on FaceTime maybe once or twice. They've used Skype. So they're pretty comfortable with the technology to the point where they're asking and expecting from large health systems, organizations, and just providers across the country.
I'm not seeing an incredible shift from telemedicine for the healthcare system, at least for the next 1 to 3 years, unless there's some drastic changes, such as some emergency or disaster or, God forbid, a pandemic. I think that we're still moving fairly slowly, which is a fairly good thing in terms of our measured response to get things right. What I'm concerned about, and this is not a view of the American Telemedicine Association, this is a personal view, is that what it could look like in 20 years. Could telepractice enable practitioners, for example, to avoid treating patients in geographically undesirable areas or with conditions that they don't want to be near? Could there be a time when telepractice constitutes the major delivery method where underserved populations do not have access to an in-person healthcare provider?
Just my final thought, I've been doing telemedicine for 15 years and never have I felt so assured and excited about our ability to be able to use these great technologies that have been, exponentially growing in our daily practice. And I really feel that we're in the midst of a transformation here where we'll be able to use these technologies to improve the quality of care to patients and make it better, more patient-centered, improve their health outcomes, while at the same time reducing overall healthcare costs. So I really want to thank everybody on the panel for joining with this very great discussion. Thank you very much.